I gotta tell you, I don't know about you, but I've got 5 kids, and don't you hate it when they're right and you're wrong? I had this big debate with my son. You know, he went off to college and became brilliant, and so actually he was a little bit brilliant before he went, but he became even more brilliant, right, when he went to college. And so we're having this big discussion about healthcare. I think I've told Rob this before, and he says, "Dad, you're wrong. It's not about everybody with their minor problems. It's about a few people with their major problems." And I said, no, Robert, you're wrong. It's all wrong. I mean, it's about, the key to healthcare is understanding how to get the patient to own the cost of little things. He said, no, it's all about a few very sick people and spreading those costs. And so, don't you hate it when your kids turn out to be right? And it turns out that he's right. That's why it's so appropriate that you're here talking about chronic diseases, because this is where the action is. Figuring out how to cope with chronic diseases is the key to unlocking the solution of healthcare. How do we accomplish that feat of in healthcare, here's the problem. On this tour, I found out some contradictory things, several lessons, and Bryce Atkinson is going to hand out something that shows you some of what we found out. It's a very, very, very short and very inadequate summary of some things that we saw, but I'll describe for you a couple of the lessons that I think we learned, or that I learned on this healthcare tour. One of them was that for my son, actually, and Blue Cross Blue Shield is the one that really drove that point home. Ed Sellers convincing me that my son Robert was right. It really is some very sick people and their cost, which you got to figure out how to cope with. So that's one lesson that I take from the healthcare tour. Another one that I take from the healthcare tour is got to get some way getting insurance coverage to everybody in America. This is different than what conservatives used to say. We conservatives used to say, well, basically get your own. But now what we've come to figure out is, gee, if everybody's not covered, you have this enormous problem called shift. And according to Blue Cross Blue Shield, they've got some interesting numbers. They say, and somebody from the hospital, I don't know whether Renee's going to agree with this or not, but they say that for the insured patient, they're going to pay at the hospital 129% of actual cost. And that's because programs that we run at the federal government are paying way below actual costs. Medicare at 92%, Medicaid at 87%. And then, of course, you've got the uninsured who are paying sometimes at 0. And so we got to accept the challenge, seems to me, of figuring out a way to get everybody covered, some way, somehow, in order to stop that cost shift problem. Another thing that comes out of this healthcare tour that seems clear to me is you got to figure out some way to have the insurance company rush toward me rather than away from me when I'm discovered to have something really bad wrong with me. So if I'm diagnosed with leukemia, the insurance company is doing this number, trying to figure out whether there's some pre-existing condition exclusion. Surely you had it before, or something to get away from me, right? That's exactly when we need them to be rushing toward me, saying, nobody wants leukemia. We got you. We're going to share this enormous risk. So that's somehow, I guess what we're talking about there is community rating. I think is what we're talking about in that case. Another thing I learned on the healthcare tour is that it's got to be, this is a total dichotomy kind of, it's just not hard to resolve. But on the one hand, we want the patient to feel the weight of the decision. We want them to have some skin in the game in terms of the economics of healthcare. On the other hand, we want them to have real easy access to prevention. And doing those both at the same time is a real trick, because we want and need a system of health care rather than sick care, which is what great system of sick care. You get sick, you go into the hospital or to the doctor, they're going to cut on you, they're going to do something to you, they give you this pill. It's something to get you well from being sick. We don't really focus, don't have a system, the economics don't work toward keeping you well. Having you eat well, having you exercise right, having you drink plenty of water and sleep and those kind of things. We don't do that very well. We also have this challenge, especially in Medicare, getting the patient to feel the cost, feel the weight of it. The scenario that I hear is fairly typical is, you know, daughter is in from Spokane, mom is dying in the hospital. The daughter says, do everything for mama. Problem is, mom is dying. And daughter hadn't spoken to mom in 2 years because they had a private Christmas party 2 years ago, and now she desperately wants mama to get better. So she says, doctor, do whatever it takes. So meanwhile, money is being spent to care for mama who's really dying. And figuring out how to make those calls requires the wisdom of Solomon. And it is really, really difficult. It's why healthcare is so complicated. And anybody who tells you they get a simple answer is clearly brand new on the job, because they haven't figured out just how complicated it is. Because the way I summarize it is this: the problem is there's a 100% death rate, and there are limited resources between here and there. Now that's a very cheery thing to say, isn't it, here at this healthcare? It's a beautiful day outside. Why don't we go out there? Inglis is in here telling all kinds of sad tales about it. But it's true. We got a 100% death rate and limited resources between here and there. So it's a very difficult problem. Unlike, say, the energy solution for our country, really, we can get after that. That's something that's soluble. Immigration, easy. We can fix that. Healthcare, hard. It's just real hard because we have these limited resources, we have 100% death rate, and we're trying to figure out a way to alleviate suffering. We came up with something that is so half-baked, I really hesitate to describe it here, but it is really half-baked, admittedly. Rob Landry heard the half-baking going on in the kitchen. But you see the utopia sort of plan down there at the bottom has a 5 points. It's really probably not worth me going into it unless you want to go into it, except basically my attempt, very sophomoric attempt, to figure out some way to do that, to alleviate suffering, spread the risk of big things, have the patient own the little things, focus on prevention by actually giving health savings accounts and funding them, actually having somebody fund them, maybe even the government in the case of Medicaid. And Medicare, actually funding the health savings account for the prevention. Maybe even requiring an annual physical out of those in that scenario. But it is very half-baked, and I've spent a lot of time on energy, and what I'm realizing there is trying to get people to hear some very out-of-the-box thinking on energy is going to consume probably most of my political capital, and I may even draw a negative balance there. I will tell you that solving health care is going to take somebody, or a lot of us, with a little bit of an account balance, or somebody with a huge account balance of political capital, because some things really need to change, especially in Medicare and Medicaid. And the thing that is, I'll stipulate here is that it will not solve the problem, is what we've attempted so far, is just a simple whack to reimbursement rates. Not going to work, not going to solve the problem. So it's got to be much more creative than that, much deeper to change the whole incentives of Medicare, so that we really are covering the big things, having patients own the little things, really doing prevention, and then making use of exciting things like electronic medical records and things like that really will make care better and make cost better too, I think.